The Emperor of All Maladies. The Emperor of All Maladies, written by Siddhartha Mukherjee, details the beginnings and progress in our understanding of cancer, including how we first started learning about it, began developing ways to treat it and discovered ways to prevent it, and the biological effect that it has on us. We right now treat malignancy with medical procedure, chemotherapy, and even radiation at times. Medical procedure can be a decent alternative for treating disease, yet it has its impediments. As far as one might be concerned, it is unimaginable to precisely eliminate malignancies of blood like leukemia, and eliminating cancers doesn't do a lot of good if the cells have effectively spread to various pieces of the body. This is the reason specialists go to chemotherapy. Key points of the Emperor of All Maladies. We've come a long way in understanding cancer. Infections, chemicals, hormones, radiation, and heredity all affect your risk of getting cancer. Surgery, chemotherapy, and radiation are the ways that we currently treat cancer. Genetic mutations are to be targeted. Prevention and early detection are essential. Palliative medicine. The premise behind immunotherapies is that the human immune system may be just as robust and tenacious as cancer's hyper-rapid evolution, which is why they are being developed. Big data is key. Overview of the Emperor of All Maladies. Our comprehension of disease has detonated over the most recent couple of hundreds of years. Around 160 CE, Greco-Roman Dr. Galen fostered the principal known hypothesis about malignant growth. He accepted that growths came about because of entanglement of dark bile. This hypothesis held until the 16th century, when individuals began to perform examinations. Doctors were astounded to find that there was not a single dark bile in sight in malignant growth patients. So they rather went to outer, undetectable sources. Until 1850 it was accepted that toxic fumes known as miasmas and worms caused cancers. When pathologist Rudolf Virchow took a gander at malignancy under a magnifying instrument, he made a critical revelation. Malignancy is really comprised of our own body's cells. Be that as it may, in case they are made of our own cells, how might they be so lethal? Disease cells are not the same as customary cells, since they don't bite the dust, and they don't quit imitating. Typical cells partition when they get development signals from their current circumstance, and they stop when they get signals from development inhibitors. Disease cells, then again, have changed development qualities. This implies that the two of them duplicate with no sign and will not quit reproducing regardless of whether there are development inhibitors. This is one motivation behind why disease is so difficult to treat. Another explanation it is so perilous is that, not normal for an ordinary cell that ages and falls to pieces, malignant growth cells won't ever pass on. This interminability, joined with malignancy's limitless replication, makes it exceptionally deadly. Your danger for malignancy relies upon contaminations, synthetics, chemicals, heredity, and radiation. We realize that malignant growth occurs in our own cells, however we additionally realize that outside sources can cause it. The primary revelation of this was from researcher Percival Pott, who examined a group of scrotal malignant growth among young men. Subsequent to taking a gander at the information, he discovered they recover, and dangerous cells kick the bucket. Other chemotherapy types influence the digestion of disease cells. They work by emulating substances crucial for cell division, yet they don't really do that. Disease cells employ these fraud substances to assist with imitating the DNA, however they don't do the work, which ends cell division and prevents malignant growth from developing. One more device used to battle malignancy is radiation, the very thing that can likewise cause it. It helps for a similar explanation: it causes malignancy, it harms DNA. Radiation therapy included utilizing controlled, serious beams to kill malignancy cells in a restricted region. They are effortless, however purpose ailment. Radiation therapy has been displayed to diminish the shot at a backslide incredibly. It likewise helps when cancers are difficult to get to, for example, in the cerebrum, where activity can cause dangerous confusions. Eventually, it is generally expected a blend of these therapies that does all stack clears, driving him to speculate that the residue amassing on their scrotum was causing malignancy. It required some investment to acknowledge this thought, however the information at last supported him up. From that point forward, we have viewed incalculable different substances to be malignant growth initiating, like asbestos and substantial metals. How do these substances cause disease? There are two stages. In the first place, substances called mutagens can modify your qualities to mess up cell development, self-fix, or implosion, causing a typical cell to change into a malignancy cell. The second step in the advancement of disease is an insusceptible framework disturbance that makes your body presently don't annihilate a possibly dangerous cell. Certain poisons can disturb your insusceptible framework along these lines. At the point when a threatening cell isn't annihilated, it can duplicate unchecked, bringing about malignancy. Contamination additionally builds our disease hazard. Some infections instigate ongoing irritation, which expands malignant growth hazard significantly by harming cells in the tainted tissue. Some infections straightforwardly cause malignancy by modifying a cell's DNA, for example, hepatitis B, which can initiate disease-related qualities. Different things are known to cause malignant growth are radiation, chemicals, and qualities. Radiation causes disease by harming the DNA, which prompts transformations that become malignant. Certain chemicals can build your malignancy hazard by filling in as development signals for both ordinary and destructive cells. In conclusion, your qualities play a factor in your helplessness to disease. This is the reason certain malignancies can run in families. For cell augmentation. It cuts off the development of cells in a space, which particularly influences malignant growth cells since they increase the quickest, and they can't fix DNA harm. Along these lines, chemotherapy viably assaults every one of the cells, however ordinary cells the most useful for a patient with disease.